Good afternoon, Mr. and Mrs. Brown. My name is Zed Chavez, and I will be your genetic counselor for today's consultation. After some initial tests, there is a possible diagnosis of trisomy 18 for your baby. Although additional tests are being performed to confirm this diagnosis, I wanted to provide you with as much as possible information as it is a very sensitive but important topic to us. In today's very brief consultation, we will be understanding trisomy 18 and its impact. Let's dive deeper into what trisomy 18 is. Trisomy 18 is a chromosomal disorder. What this means is that it is a genetic disorder that directly impacts or interferes with our chromosomes. Chromosomes are small structures in our cells containing genes or genetic information. Typically, a human cell contains 46 chromosomes, which are arranged in pairs of 23. When trisomy 18 is present, that means we have an extra copy of chromosome number 18. This means that instead of having the normal pairs of chromosomes, we have additional chromosomes disrupting the normal pattern. This additional chromosome disrupts normal patterns and can lead to significant challenges in the newborn baby's life. Infants with trisomy 18 may often experience growth restriction in their mother's womb, leading them to have a very low birth weight. They might also have physical characteristics such as a very small head size, malformed feet, and a clenched fist with overlapping fingers. Infants with trisomy 18 also have organ abnormalities, meaning specific organs might not be able to correctly function. All this leads to a very serious and sad prognosis. Many infants with this disorder do not, in fact, live beyond their first year. In many cases, however, some may live longer but will need constant and intensive support and constant medical treatment. To further develop our understanding, let's talk about karyotypes and how they help us understand conditions like trisomy 18. A karyotype is essentially a picture or a map of a person's entire chromosome collection. Chromosomes are found in nearly every cell in the body and carry our genetic information. Humans typically have 46 chromosomes arranged in 23 pairs. Now, if you look at a karyotype, you can see that chromosomes are organized in pairs, and they are numbered from 1 to 22 plus the sex chromosome, which would, in this case, the ones presented to us are female chromosomes. XX is female, XY is male. In a normal karyotype, which we'll call the red karyotype, there are two chromosomes in the 18th position as there should be. This represents a typical structure of chromosome pairs. However, in the trisomy 18 karyotype, shown here in blue, the 18 chromosome pair has three copies instead of two. This is what we call trisomy, tri meaning three. This extra chromosome disrupts normal development, leading to medical challenges associated with trisomy 18. How does this happen though? Most often, it is due to a process called misjunction, which means that the chromosomes didn't separate properly during the formation of egg or sperm cells. This results in an extra chromosome being added or passed down to the baby. It is important to note that trisomy is usually not inherited. It occurs randomly during conception. However, in some very rare cases, one parent may carry a balanced translocation, where their chromosomes are rearranged but no genetic material is missing or extra. This increases the chances of passing on an extra chromosome to their child. The bright red circle around the 18th chromosome in the trisomy 18 karyotype emphasizes this extra chromosome and helps us visually confirm the condition. Let's take a closer look at how a pedigree helps us understand the inheritance patterns of genetic conditions like trisomy 18. A pedigree is essentially a family tree that shows how a specific trait or condition is passed down through generations. In this case, we're using it to explore trisomy 18. In most cases, trisomy 18 is not inherited. It occurs randomly during conception due to a process called non-disjunction. We have previously talked about this. Here's what the pedigree tells us. Circles represent females and squares represent males. White symbols indicate family members who are unaffected by trisomy 18. Gray symbols represent individuals who carry a balanced translocation. This means a rearrangement of chromosomes that doesn't cause them health problems, but can still increase the likelihood of passing an extra or missing chromosome to their baby. A red symbol in this case represents a child affected by trisomy 18. To fully confirm that trisomy 18 in your case, Mr. and Mrs. Brown, is fully genetic or completely random, we would have to further do genetic testing. This will later be discussed in case recommendation. For this part of the consultation, we have come up with our most frequently asked questions and their answers. Our very first question is, what causes trisomy 18 and is there anything that could have been done to prevent it? To effectively answer this question, we must look at the two sides: our very rare inherited trisomy 18 cases and our very common by chance trisomy 18 cases. The most common cases of trisomy 18 are a random event known as non-disjunction. This happens when chromosomes don't separate properly during cell division, resulting in the extra chromosome. This is usually a one-time occurrence and nothing can be done to prevent it. It can happen to any parent at around any age. On the other hand, in rare cases, trisomy 18 can be caused by translocation trisomy 18, where one of the parents carries a balanced translocation. What this is that the parent has a rearrangement of their chromosomes that doesn't cause any issues for them, but it can increase the risk of their children having an extra chromosome. In this case, genetic testing can be done to effectively see if either parent carries this translocation. Identifying this can help guide future family planning and understand the likelihood of passing the condition on to future children. For our second question, it says, what is the likelihood that we will have another child with trisomy 18? Once again, to answer this question correctly, we have to look at two sides. For inherited trisomy 18, there is a higher risk of having another child with this disorder because if a parent carries a balanced translocation, the risk of having another child with trisomy 18 could be higher. By chance trisomy 18, meaning there was non-disjunction, the chances of having another child with trisomy 18 are lower, similar to the population risk. This is typically about 1 in 3,000 to 1 to 5,000. Our third question is, are there any treatments or interventions for trisomy 18? Trisomy 18 is a condition that affects all the cells in the individual's body, meaning nothing can be done. However, treatments or interventions such as surgeries or assistance can aid the living process. Based on your situation and the tests conducted, we'll review the available genetic testing options, discuss your reproductive choices, and explore potential treatments. We'll also consider the ethical aspects of making decisions in this context, ensuring that you and your family have the right information to make the best and informed choice for your family. For genetic testing options and family risk assessment, to confirm the cause of trisomy 18 and assess the risk for future pregnancies, there are genetic tests available. Fetal diagnostic tests such as amniocentesis, which is a test where a sample of the fluid around the baby is taken to check for genetic conditions, or chorionic villus sampling, a test where a small piece of the placenta is tested for genetic problems, can confirm if trisomy 18 is due to non-destruction, which is the random error in cell division, or a balanced translocation. If non-destruction is the case, the likelihood of the reoccurrence is very low. However, if a parent carries a balanced translocation, which is a rearrangement of chromosomes that does not affect an individual, the risk increases. In carrier screening is recommended as it would help assess your entire genetic risk. Understanding your reproductive options. If trisomy 18 is due to random error, the chances of it happening again are very low. However, if the balanced translocation is identified and present, options like preimplantation genetic diagnosis, or PGD, a test during in vitro fertilization to check embryos for genetic conditions, is recommended and can be considered for future pregnancies. You may also want to choose to monitor future pregnancies with screenings like non-invasive prenatal testing, which is a blood test to check for genetic conditions in the baby. These can provide early insights into potential risks. There is no cure for trisomy 18, and care focuses on managing symptoms instead of alleviating them or solving them. This is done through palliative care. This is care aid at improving comfort and managing symptoms. This may include feeding assistance or support, respiratory care, and other treatments to make the baby as comfortable as possible. Many babies with trisomy 18 experience severe medical complications. Palliative care is essential to providing comfort for these medical complications. You may want to consider palliative care options and discuss measures that could be taken. Ethically, decisions around continuing the pregnancy will depend solely on you, and genetic counseling can provide support in navigating these options. Given that you and Melissa have expressed concerns about knowing this information before the baby is born, you may also choose to monitor any future pregnancies with early prenatal screenings such as first trimester screenings or non invasive prenatal testing, which can offer reassurance or early warning signs of potential genetic disorders or conditions. Lastly, given your situation where you and your as a couple have two healthy babies at home and are relatively young, it may be reassuring to know that the condition occurred by chance. The likelihood of it happening again is low. However, if either of you carry a balanced translocation, a genetic condition that can be passed to the offspring, this could be a higher risk of reoccurrence. Mr. and Mrs. Brown, we understand that this is a very challenging time for you, and this information discussed today is meant to help you feel informed and supported in making the best decision for the future of your family. Please remember that you have options for support, care, and testing, and the choices you make reflect what is best for your family's well being, in your opinion, and your values. Take your time and don't hesitate to reach out if you need additional information and support. Thank you so much for today.